Dr. Kat, epidemiologist. The federal COVID-19 Public Health Emergency declaration ends tomorrow, May 11th. So what does that mean for us? COVID remains, as we are aware, an ongoing public health threat, both domestically and abroad. And COVID is still a public health priority because COVID is not over. I wanted to break it down into what will change and what won't change here in the U.S. So first of all, vaccines, boosters, and treatments, paxlovid, will remain free for a while because we have a lot of them in the national stockpile that were purchased under the public health emergency. So that's good. Tests will largely not be free anymore. There will be no more free tests from the U.S. government. If you have private insurance, you might still get free tests, but that's kind of a company by company basis. Money that's been set aside during the public health emergency to treat COVID is now ending. So if you are unvaccinated, I would highly recommend that you get vaccinated now, because if you get admitted to the hospital, it may not be covered. CDC's ability to collect and share certain data is going to change. So I wanted to talk about that. Our data availability is not going to be the same. So COVID-19 case and death data will no longer be on the CDC data tracker. So listen again, case and death data will no longer be on the tracker. Test positivity from COVID-19 will no longer be available. The V-Safe program, the program that you would do on your phone after your vaccinations for health check-ins, is also ending. Deaths will still be reported, but they will come from the National Center for Health Statistics from death certificates. So the percent of total deaths that are attributed to COVID for the week will be reported. Also, there'll be a weekly tracking of COVID hospitalizations and emergency department visits to sort of have a real-time tracking of severe COVID. And lastly, wastewater surveillance will track incidents. That's going to replace the case data that was coming from the states, and viral variants will be tracked in the wastewater data. So I hope that helps. If you have any questions, put them in the comments and I will respond to your comments.